So good afternoon, everyone. We have a nice crowd here today. Thank you so much for coming to our webinar this afternoon. Happy Friday, most importantly. I'm Jamie Seward, Senior Associate Director of Alumni Relations with the Johns Hopkins University School of Medicine. And before I start the program, I'd like to acknowledge our sponsor, our Office of Alumni Relations. And I also encourage you to ask questions during the program by typing them in the Zoom Q&A located at the bottom of your screen. Now, I have the pleasure of introducing our guest speakers who have been with us several times, and they're always a great draw because they're experts and we really appreciate them. So first of all, John Deming is the Director of Safety and Security at Lakeland Regional Health. It's the 5th largest hospital in Florida and home to the 2nd busiest ER department in the nation. He has over a decade of experience in hospital safety, security, and emergency management. He earned an MA in public management from Johns Hopkins, and his undergraduate studies were in public safety and security at Florida State University. John is joined by Paul Sarnis, the owner of Secured and Prepared Consulting, LLC. He's a certified healthcare protection administration he is a certified healthcare protection administrator and a certified associate project manager. He has a bachelor's degree in criminal justice from Rowan University, a master's degree in safety engineering from Warren University, and a master's in administrative science from Fairleigh Dickinson University. My words are not doing well today. Sorry, guys. It's now my pleasure to turn the program over to you two.
Thank you, Jamie. Thank you for that great introduction. Thank you all for attending today. So artificial intelligence is a rapidly improving healthcare security with all kinds of measures like detection of concealed weapons, facial recognition software, video surveillance, all kinds of exciting emerging technologies that while they're properly employed, could really increase the security posture and the safety of your patients and employees in your hospitals. So the purpose of this presentation today is not to get too technical. You know, we're not going to delve into the super specifics of the technology. We just want to give you an overview of what some solutions may be and how you can employ them. So just to kick it off here to my partner, Paul. So Paul, we hear a lot about AI and in layman's terms, can you describe it?
Well, thank you. First of all, thank you, John, for setting the table here. We're truly not experts in the field of artificial intelligence, but as security practitioners, we know all the great advances within the technology that allow us to provide a more safe and more secure environment for our organizations where great patient care can take place. So in layman's terms, it's computers doing the work of humans. It's basically computer algorithms that could process information very quickly to make decisions. And these algorithms can basically detect patterns, anomalies. They can detect breaches in security protocols. These algorithms are very, very powerful and quick. So artificial intelligence is here to stay. It's something that we need to embrace from a security and safety and emergency management. There's a lot of applications for artificial intelligence. And I think we're really just starting to see the kind of the cusp of what it's going to be in the future. But really, I think for today, it's saying these are really the goal of today is to say these are the cool things that are available today that practitioners really ought to investigate, do their homework, and see if there's applications in their environment that can certainly improve again the safety and security of their facilities. So that's my layman's definition of artificial intelligence. So John, why don't you tell how is it currently being used in healthcare today?
So there's actually an increasing number of businesses, around 35% around the world that are using AI, and an additional 42% are exploring the technology. Currently in hospitals, what we're seeing is it's really being used a lot in precision medicine. It's being used to identify tumors on radiology images, being used for chat GPT for patient navigation. Also in the closer to the security realm, it's also being used. AI is being used to model and proactively identify irregularities when it comes to fraud and abuse, suspicious activities such as a caregiver that's serving two patients simultaneously, or if there's an instance where caregivers are providing care to the same patient at the same time, or if a caregiver is reporting that they are providing care, but they're actually located in a different place during that service. So it's really helping hospitals identify some of those irregular activities that may warrant some further investigation. And it usually happens pretty quick too. The AI is able to identify something that looks suspicious pretty quickly, and it's able to notify the necessary personnel so that it can be investigated pretty quick, usually within just a few hours of the visit. So, that's currently how we're seeing it being used right now. So Paul, specific to healthcare security and safety, how are you seeing AI being used?
No, it's phenomenal opportunity. So what's again, I really think we're on the cusp of this, but it's the opportunities are almost endless at this point. But certainly the ability to process a lot of information simultaneously, a lot of inputs, and we'll talk about that a little more in detail as we go on, but a lot of inputs, a lot of streams of information can be quickly evaluated, which increases response time for security officers. It could also predict events based on those same inputs, based on information monitoring that. So it's certainly going to increase how we can detect suspicious activity, maybe an unauthorized access, maybe a person of interest that we don't want to necessarily be in our facility. At least we want to be aware that they're in our facility. We can quickly identify that. I think it will, just imagine how long it would take me to look at 16 hours of video from multiple cameras. So AI could speed up how quickly we're looking at all that data, how quickly I could scan that to see if there's any suspicious activity. I also think there's, from an operational perspective and an efficiency perspective, there is potential opportunity for savings. I'm not concerned. I know many of us are concerned about AI replacing our jobs in the future, but I think there's going to be a blend and a complement of how AI can enhance our efficiencies, but also, with the complement of both technology and humans, we could I believe reduce some operating costs and improve efficiencies. I also think, more importantly, from a decision-making perspective, I mean, data is what we make every decision on, right? Especially in healthcare. Healthcare is evidence-based. We don't invest in our time, our energy, and our resources without evidence demonstrating that the intervention or the new technology or the new program, whatever it may be, is going to have a positive impact on patient outcome or a positive impact on another goal that we're trying to achieve. So AI is certainly going to help us make better decisions for how we're going to allocate resources. And from a safety and security perspective, again, it's having the ability to process a lot of information to proactively identify risk so we can respond either to mitigate it or eliminate the risk by seeing it early, or at least to be able to respond quicker, because we all know that in an emergency, time is of the essence. So, there's a lot of cool analytics that we'll talk about in a little bit later that really allow us to detect suspicious activity. So it could be something we pick up with an audio sensor, something that artificial intelligence hears, something that artificial intelligence sees through a camera. All these analytics and these devices really will just improve all of our operations and all of our efficiencies. And you talk about situational awareness. Imagine watching 10 different news channels at the same time and trying to process all that information and trying to make decisions as to where you're going to allocate resources or how you're going to respond. Incredibly difficult for us to do that as humans. But artificial intelligence and the analytics and the algorithms can take all this input, weather information, crime information, news information, population density, anything that's being monitored, traffic patterns, and be able to proactively say, based on this information and this data, there's a likelihood that an event could occur. Based on this data, we need to deploy resources in this area to mitigate the risk of a bad thing happening. So I think it's the impacts are going to be just phenomenal. So it's going to improve our response time, improve our efficiency, reduce our operating cost, help us making decisions, all those things that we depend upon ourselves to make today. It's certainly there needs to be a human in the loop to help validate that information, but really artificial intelligence is really going to just really improve everything that we're doing to keep our facilities safe and secure. So, John, you and I, we talk about, the issue of workplace violence in healthcare today. I mean, it's a
Sure.
significant incident or a significant issue. We know that healthcare employees are 4 or 5 times more likely to be victims of aggravated assault than any other industry. And
Right.
two nurses are assaulted every hour, 57 a day. I mean, the statistics are just, not good. And there's a lot of great there's a lot of great synergy right now with people dealing with workplace violence in healthcare, which is awesome. But
Absolutely.
how do you think AI could help reduce workplace violence incidents in healthcare?
Yeah, well, first of all, Paul, I have to apologize. My computer actually just shut off on me, so I had to emergency join by my phone, and I can't have my video turned on because it's blocked. But anyway, I am able to join through the phone, so I apologize for that. But when it comes to workplace violence, you hit it right on the head. I mean, it's a really big issue. It's starting to become very prevalent and highly publicized, which is a very good trend. I mean, it's unfortunate that it's happening, but lawmakers and organizations like the ANA and the ENA are highlighting the issue and kind of raising their hand, like, hey, this is happening to us, help us. And it's really encouraging that organizations and lawmakers are paying attention to the issue, and acknowledging this big problem. There are leading hospitals are really utilizing AI and machine learning for things that are called predictive analytics. And what these tools do is that they foresee potential aggression by looking at patient histories. If a patient had been violent with staff in the past, they're able to flag that behavior in the health record, so that if that patient does come back, it will immediately pop up and let the caregiver know that this patient has a history of violent behavior. Also track behavioral patterns. And what this does is this enables staff to have early intervention, right? If you know about it when a patient comes in that they have a history of these types of behaviors, we could utilize de-escalation, talk to the patient first, perhaps level set with the patient from the very beginning. Maybe that's not always possible, of course, if there's some kind of a mental health or a traumatic brain injury type of deal. But in a lot of situations, talking with the patient preemptively, level setting, letting them know of what the expectations are is highly helpful. And you can't do that without knowing prior, right? I mean, if there's a patient that was up on one of the floors 6 months ago that assaulted a patient, and they come back into the emergency department, and they're not going, that nurse or that caregiver is not going to know unless this AI is in place to flag and let them know as soon as they start creating the chart. And some other applications, particular to computer workstations, as the all these events become highly publicized when it comes to hacking and these malevolent characters that are coming into hospitals and more or less taking their systems hostage, right? Asking for money to unlock their systems, and it has very big, deep impacts on the operation of the hospital. And one of the ways is AI can use algorithms that identify suspicious activity, and they flag suspicious login attempts, which obviously makes it easier for your IT teams to identify potential breaches. I think that's the really big one. I mean, I think that these breaches are starting to become very prevalent. And also in particular, going back to the physical security side, video analytics is really becoming a great tool with AI, and it's really becoming sort of a force multiplier, right? You know, these cameras are deployed all over the hospital, and using this AI technology, security personnel can quickly analyze video footage to identify potential threats. Facial recognition can be used to track a subject. If you know, so again, if someone were to have a history of violent behavior, or perhaps a trespassed individual were to come back onto campus, the facial recognition software can identify that individual through the camera and alert the security team, which is a fantastic tool. Uh, there's also uh, there's also uses when it comes to detecting weapons. If someone were to come into a facility with a shotgun or a rifle or a handgun on their person, there are a lot of technologies and AI out there now that can identify those on camera and alert the security team. Also, human interactions, right? These AI pieces can detect if there is a person that's showing a fighting gesture, for instance. If you're out in an ED triage and there's an upset person and they put up their fists into a fighting stance, these cameras can now identify those gestures and those poses, and get that out to the security teams to alert and get the officers out there. Could also be used in patient falls as well too. I know, I'm sure a lot of people on the call are aware that patient falls is a very prevalent subject when it comes to healthcare. A lot of patients are immobilized, or they're under, they're on medication, and patient falls is a big issue. So AI, while employed with cameras, can detect those patient falls, that the patient can get help as soon as they need it. When it comes to traffic data, these AI cameras can detect things like the type of car, SUV, pickup, sedan, trucks, buses. They could be used to automatically read license plates to make sure that people that are trying to get access to a secured parking area have the necessary access. It also eliminates some steps too, right? If you have a database of your employees or your doctor's license plate numbers, it eliminates the need to scan a badge to get into a specific parking area, which is convenient, but it also provides a lot of security assistance too, right? I mean, if someone tries to get in there and it's a former employee that perhaps may have had a history of potential violent behavior that needs to be let go, the cameras will pick up on that, and it can alert the security team, hey, this is a unauthorized individual that is attempting access into the parking garage or the parking structure. And that could alert security and law enforcement to preemptively get out to that person before it does become an issue inside of the hospital. There's also sound recognition as well too. The AI is coming out with things like gunshot detection, to where if there is a gunshot that's detected within the area of its space, that it will alert the security team. Also things, and you see some of these things at home too, with like home security systems with glass break, where if it detects that glass is broken, it will alert the security team and get the necessary personnel out there. And also for mechanical failures as well too, for the actual physical space, these sounds can detect a particular device that is making a knocking noise, or if it's overheating, or if it's doing something that it's not supposed to be doing, it could alert the necessary personnel to get them out there. So those are just some of the ways that AI is really being used, and can be used to increase security and safety at a hospital. So, Paul, what are you seeing as other security processes that can be improved with AI?
Well, I think, I mean, you covered a lot of them there, and it's just fascinating to me.
Sure.
Like you talked about the sound detection, and recently saw an article about graffiti, the sound of the spray
Right.
paint
Yeah.
being picked up. And I thought that was really cool, because in a lot of urban environments, that's significant concern is property damage. So the technology of picking up specific sounds, I think it's just going to continue to expand. And even from a sound perspective, picking up a key word. let's just say,
Right.
I'm in a patient's room, and there's an in-room camera, and the camera is not on, but in the background there's the monitoring of the noise, the ambient noise, and I happen to be in the room with the patient, and the patient may be getting a little aggressive, and all I
Mhm.
have to do is say, Dr. Armstrong, as an example. The camera can then be turned on. The camera can then trigger a response from a coworker, security, to come and intervene and help me out. So I
Wow.
think it's just really
Wow.
cool
Yeah.
stuff. Yeah,
It's
it's
almost
awesome.
like it works almost like a duress alarm in a way.
Yeah, exactly.
Wow.
Yeah,
Interesting.
yeah, it's pretty cool. But a lot of organizations right now, I have the pleasure of traveling and visiting a lot of hospitals, and we're kind of like the two big interventions that organizations are looking at right now for um, to mitigate workplace violence. Depending upon location, clientele served, and services provided, but it's a lot of weapon screening technology is being evaluated right now, and a lot of, I think that the second thing that's really being looked at is wearable or portable panic devices for employees. But when it comes to weapon screening, I was an early adopter of walk-through metal detectors and handheld metal detectors. And in days of old, you would have this big clunky walk-through metal detector that only
Right.
detected metal,
Right.
right? And then you'd have
Hmm.
to put your objects, your bags, and your backpacks and things on an X-ray machine. And then if there was a hit and you identified something, there was a secondary search with a handheld metal detector. Well,
Right.
the technology today
Yeah.
from an AI perspective, it's phenomenal. So it's weapon screening and people screening with artificial intelligence. So there are sensors built into these devices that are picking up the object, putting a box around the object to focus the attention to the security officer or the practitioner so that they can,
Hmm.
do a secondary search as well. But these devices today are sleek, they're not big and bulky. They're not intimidating looking. It doesn't give you the perception of walking through an airport or a
Right.
courthouse. They're very sleek, low profile, not intimidating. So, from an organizational and cultural perspective, you're providing a safe and secure environment by doing the people screening and the weapon screening, but you're not creating that intimidation as well. And the technology too, from a data perspective, it's amazing.
Oh yeah.
So it's
Absolutely.
counting the number of people that are coming through. It's telling me the peak times of activity. It's telling me how many weapons or contraband I detected, and that from a managerial perspective, I can staff appropriately based on the peak times of use. I can use all that data to make decisions. It's just amazing. And from a time perspective, I mean, we want to make our facilities, obviously warm and welcoming. Um, but we also want to make them very accessible. So we don't want to delay people from coming in. So these weapon screening devices with the artificial intelligence, you can process thousands of individuals per hour, thousands. And people don't have to take their backpacks and have that searched, or their computer bags have to be searched. All the technology is doing that for them, and it's just amazing what's available today. The other thing from a that we're seeing is really taking a lot of information from open source information and using that information for risk intelligence. So again, you're taking information from all these different inputs. Again, it could be population density if that's being monitored. It could be traffic flow. It could be weather. It could be crime. It could be employee. It could be individuals posting things on Instagram or Facebook and hashtags. All these different things could be monitored through AI to identify potential issues or potential unsafe conditions, or maybe, God forbid, an unsafe act that somebody may be planning. So, the artificial intelligence monitoring all these different open source informations really provides some great ability to improve the security, identify risk early, and improve our efficiency. So it's just amazing what the systems can do today.
It
From
really
a
is.
visitor management perspective, John, you mentioned facial recognition earlier. So if I have an individual that we have a bolo out for, so bolos will be on the lookout for. So we had an individual that You know, and this happens, unfortunately. We have visitors that don't act appropriately when they come to visit their patients. We have visitors, unfortunately, that try to bring contraband in to the patient, and it could be in the forms of a weapon, or it could be in the forms of narcotics or any other contraband. But through facial recognition, the visitor management systems can see that person of interest when they're walking into the facility or in their parking lot, wherever the camera's deployed. And that could then trigger a response. It could tell security that the person of interest is here, and security could, you know, maybe just want to be aware of it, or security could intervene, maybe deny access to the facility. But, you know, having that information, you know, the face, and to be able to early recognize that is huge. And then from a visitor management perspective, kind of think about what I mentioned earlier with the weapon screening, the data. So
Mhm.
artificial intelligence looking kind of overriding on a visitor management system could tell you all those data points that help you make operational decisions. So when are people coming in? How many people are coming in? So here's another example from visitor management. Just say I have on the camera some artificial intelligence, and I want to know when a large group of people come in, because typically visitors come in 1, 2, 3 at a time. I want to know when 10 come in at the same time, because
Mhm.
that's out of the ordinary. That could be telling me that something bad is happening inside the hospital. Maybe the patient's not, you know, kind of crashing a little bit, and the family's coming in, and I want to know that too, so I can provide great service to that family. But it could also be a bad thing. It could be that these 10 individuals maybe were just involved in a something that occurred off campus, and they're rushing into the ED to seek shelter and seek safety. Either way, I want to know what's going on.
Sure.
So that the cameras can tell us that. Overriding artificial intelligence on visitor management gives us the same data I mentioned earlier about weapon screening. How many people are coming in? Where are they going? And maybe I want to know, when people come into my facility, how they travel. So cameras today can actually identify an individual, tag the individual, track the individual. So if you want to see spaghetti diagrams where people are going in your
Mhm.
facility, you can do that today. And you think about retail businesses, a lot of the big box stores are using this technology today to kind
Mhm.
of see where they need to put their you know, what needs to go on the end cap on the aisle. You know,
Sure.
what
Yeah.
needs to be there
Right.
for that, you know, that last kind of impromptu impulse, you know, buy. So
Right.
you can use um, all of this technology really to improve not only safety and security, but operations. You know, I always use the example. 10 years ago, I used to sit at home, and I would be on my computer when it was snowing, and I would look at the cameras at my hospital, so I would be able to deploy, you know, the snow removal, or the facilities team.
Right. Yep.
Well, now, how about the camera just do
Right.
it?
Yeah.
I don't
Exactly.
want to have to monitor. If the camera sees that it's snowing, the camera can push an alarm and
Mhm.
through a system to notify the right people to take action. So it's again, talk about not only improving safety and security, but improving our operational efficiency and our bottom lines. I really believe it's going to make us much more efficient as we go forward. So those are
Mhm.
some of the big things I see: weapon screening, visitor management, that risk intelligence. But there's a lot of other applications out there, that's for sure.
Absolutely.
So, so John, do you have any like real life examples that you want to share with everyone?
Sure, absolutely. So, just an example of how AI can be used in like a real life scenario regarding, security officers in a healthcare facility. So, for example, let's just say that a security officer is pouring or patrolling a facility, and he's using his key card swipes to get into doors, right? So those key card swipes are logged in security software. Associated cameras that are in that area provide video evidence of his or her activity while he or she is performing that patrol. And with that video and the information in there, it provides a log of the access control event. It shows the officer where he or she was at what specific time. If that officer were to be engaged, or if there was some type of violent event that happened during that time, the cameras will be able to pick that up, notify the security team, to get some backup out there or some help. Or this could even apply to an employee as well too. If there's an after hours entrance where employees are coming in and out and they encounter some type of a violent individual or some type of suspicious event, preemptively notifying the security team is paramount. And video surveillance and video management systems are able to accurately count the people in real time beyond simple just counting of the people coming inside. The AI systems, they can compare the counts and trigger a notification if it doesn't meet the expectations. And this could help security rapidly identify problems. Like if this officer were to be on patrol and they were to notice that there was an unauthorized access, the camera could help the officer identify that. The camera could also help identify packages or bags that are left behind. If a door is left open, if a restricted access door is left open, the camera could notify the security SOC or the security radio operator to let the officer know that that's happening, and maybe that's something that he needs to go look at. Kind of touched on it before. If there is a person that is acting erratically or getting into those fighting type of poses, the camera can preemptively, and the AI technology can preemptively let the officers know while he's on patrol to get to the place that he needs to be. And also when it comes to traffic control as well too. If there is a vehicle that's perhaps driving on the wrong way through an ambulance bay or through a patient drop-off area, that could the camera and the AI could pick up on that and let that security officer know that he needs to get himself out there to control that situation. So those are all just kind of different examples of how the AI could really be used in a real life type of scenario. So Paul, with all these things that we've been talking about, AI is here to stay, right? It's not going anywhere. It's only going to become more prevalent, right? I think everybody can agree with that.
Sure.
So, with all of that in mind, how do you envision AI being used in the near future when it comes to healthcare?
I think we're in a point right now where if you dream about it or if you want it to happen, the chances are we can make it happen. So take the scenario that you gave earlier, right? So the security officer is doing rounds. They're using their badge or their credential to patrol certain areas. The camera is confirming that they're in the area. Let's just say that the officer is patrolling and the officer identifies an unsafe condition, okay, or something that requires an incident report. I see in the future, and we're getting really close out, where that video, so there's something that occurs. So the door's propped open, a forced entry. So the access control system picks it up. The video management system picks it up. Video management automatically saves the video a minute before the incident, and then from the time the incident occurred to the incident's over. That pushes the information right into an occurrence reporting system. It opens up the occurrence report. It starts a case number. It adds the transactions for the access control. It adds the video clip. It adds all that information right in there. Not only is it documenting and saving it, now it's saying, well, there's some other rules associated with this particular incident. When this particular incident occurs, certain triggers are going to happen. Certain processes are going to occur. So the door is forced open, video is connected, the incident report's generated, but I also need to notify somebody. I need to notify my security supervisor. I see in the future that push of information to the right individual so that it's creating actionable items and improving response. So I really believe that if we think about it, it could happen today. So physician pulls into the doctor's parking lot, camera picks up their license plate through a license plate reader, gate opens up. Physician walks to the physician entrance. The card reader identifies his cell phone in his pocket, unlocks the door. Physician then walks into the physician lounge, uses his smartwatch to open up the door. The electronic medical record and the facility IT infrastructure recognizes the physician's credential, logs the physician into the EMR system. Physician does what he has to do or she has to do, goes into the OR, walks into the OR and says, Alexa, I'm performing a procedure today. I want the lights set up this way. The lights are moved. They set up. Physician says, Alexa, okay, now let's do a timeout. Alexa walks the OR team through a timeout, and at the same, it's documenting who's in the room, what the temperature is, what the humidity is, all of the equipment that's in the room, all the implants in the room are being identified. They're being logged in the electronic medical record. It's all being tracked. The ambient noise is being picked up, so the physician and the team are kind of dictating what's happening during the procedure. All that information is being transcribed, put right into the medical record. So I see that really in the near future. And I'm sure there's pieces of that exist today. I know there's pieces that exist today, but I really see that as being something that we're going to see in the future. I also see from an emergency management perspective, and you guys are COVID, we all lived through the pandemic.
Yep.
And if you think about what came out during the pandemic, facial recognition became really important. We were able to distinguish between a person wearing a mask and a person not wearing a mask, and that was
Sure.
again on through the camera. The cameras told us when people were closer than 6 feet apart. Cameras helped us enforce social distancing. Cameras helped us do contact tracing. They did all those different things, but from an emergency management perspective, I mean, there were some throughout the world, there were some incredibly tough decisions that people had to make when it came to crisis standards of care. I have
Mhm.
I have two 53-year-old male patients that are in the same medical condition, and I have one ventilator. What am I going to do?
Yeah.
Am I flipping a coin?
Mhm.
Am I gonna go to a group of peers to make that decision? I see AI helping in that. I mean, I think there has to be a human in the loop from an ethics perspective, but I think AI is really going to help us make some of those decisions from an emergency management perspective. And the other thing too, I thought was pretty cool. And you and I had the opportunity to speak to some individuals that were really into AI and really this
Mhm.
technology, and the ability to hear conversation. So God forbid something bad happens, right? And our switchboard operators are being they're getting a lot of phone calls and just for information, what's going on. I want to know
Sure.
where the vaccines are. I want to know what time the vaccines are being provided, all this. Well, the artificial intelligence can listen to those conversations
Mhm.
and transcribe those conversations, create a list of frequently asked questions, also combining with the appropriate answers. Again, humans in the loop have to review and verify all this stuff. But then, just think about compiling all this information, especially when you have hundreds or thousands of calls coming in. Well, that artificial intelligence can now be kind of prompted to provide that information to the caller in the beginning. If you're calling about
Mhm.
this, here's the answers. So you talk about taking a massive amount of information, processing it quickly, and putting it in a usable form that's going to help us manage, God forbid, an emergency or our daily operations. I mean, I just see that it's endless what AI is going to be able to do for us. From a chat GPT perspective, I think we'll all have a little concerns about that. What
Sure.
it can
Yeah.
do, what it
Yeah.
can do, and writing college papers for kids and doing things like that. But I think that there's going to be a lot of great clinical uses for chat GPT when it comes to educating patients and when it comes to helping patients navigate the sometimes very difficult healthcare environment that we live and work in. So I just see it having just the potential is endless, and I know more and more organizations are looking for AI to help be more efficient, and it just again I think that the possibilities are just endless. I mean, think about the same scenario that we talked about with the security officer rounding. I mean, we're in a patient's room and there's a camera inside the patient's room. Nothing to say that camera can't pick up a change in color, that camera can't pick up a change in activity and notify the
Sure.
nursing staff.
Mhm.
Or, just like we have bed alarms that are connected to electronic medical records. So the patient moves, And the patient is identified as a fall risk. Well, the patient moves in bed, it sets off the bed alarm, turns on the camera, notifies the staff at the nurse's station, starts recording the video, and puts that video inside the medical record, notifies the clinical folks that need to be aware that the patient's trying to get out of bed. I mean, I just really see improving patient care and outcomes in the future.
Yeah, absolutely. I mean, there's just there's just so many applications for it. I think that it would be foolish to think that it's going to go away. I think it's just going to become more and more prevalent. And I think that there's some aversion to AI. Is it going to take over the world? Is it going to take people's jobs away? And I think that some of those concerns, may be valid to some extent. However, using AI in an ethical manner and using it the right way, I think really what it does is it does a lot of the legwork for the end user so that we could deploy assets smarter and better. And like you said, how long is it going to take for one person to monitor 16 hours of video, multiple camera angles? That's a lot of time wasted. If you use AI the correct way, that time spent can be used for other things that are of importance.
Mm-hmm. Yeah, John, if I can just add to that. So just take those 16 cameras for 24 hours. Now I could literally go into the system, create an avatar. So if you're looking for me, Paul Sarnese, wearing a white shirt and a blue jacket, and you can literally create an avatar of me in the system, look
Mm-hmm.
just like me, and then say, look for that avatar, look for this person in the video. And within seconds to minutes, you would have all the video clips of that individual.
Absolutely. Yeah. I mean, it's a really great tool, and it's going to be very interesting as time goes on to see all of the other possibilities that AI brings to us. So Jamie, I think we hit on everything that we wanted to talk about. So we'd love to hear from the audience and take some questions.
Yeah, so I have a couple questions in the Q&A. First of all, thank you so much for all the great information. So I will look at our first question. So using AI to track, identify irregularities in caregiver patient situations is fascinating. Is this being used in long-term care settings such as skilled nursing facilities? Pre and especially post-COVID, adequate caregiver staffing is challenging, and caregivers report providing elder care that in all likelihood is falsified.
I can answer that too, because I have an example that came right to my mind is the first thing that came to my mind was drug diversion. So, we have medication dispensing machines or Pyxis machines or Omnicells where, clinical staff can go get medication. Okay. And that's tracked in that individual dispensing machine. Today, every individual dispensing machine could be monitored simultaneously. All the medical records could be monitored simultaneously. The controlled substances in the pharmacy could be monitored simultaneously. And artificial intelligence can really help identify deviations in practice. So if Paul Sarnese is a nurse and I'm giving out 10 oxys a day, and John's a nurse and John's giving out 1 oxy a day, it's a deviation. That's going to be identified through the artificial intelligence. And just think about the time that's saving people for looking at all those individual reports. It's doing it actively, constantly, to see if there's any deviation in practice. So that was the example that came right to my mind, because that particular organization I work with is a long-term care facility, and they're using that technology.
And also for pain scales too, right, Paul? I mean, if there is a patient that is getting a pain med every 4 hours throughout the day, and they are constantly reporting that my pain level is a 7, my pain level is a 7, my pain level is a 7. Okay, what's going on there? This patient is getting pain meds, but they're reporting that their pain is not going away. So we have used those in drug diversion committee investigations, to where if that happens with a patient, it will flag and it will let us know, so that it's something that we need to look into potentially. Perhaps maybe the patient is just in a lot of pain, and it's completely something that's not an issue or suspicious, but it flags it so that we could take a look, because oftentimes things like that are an indicator that perhaps there's some drugs that are being diverted.
That's a great point.
That
Yeah,
is.
the other thing I always think is staffing is such an issue, Jamie. Everybody's struggling with staffing, right? So I see, and I'm sure there's components of this today, but where artificial intelligence can look at staffing models, number of RNs, number of physicians, LPNs, whatever, all those different job codes, look at the complexity of the patients, look at all of the patients that are, are high acuity, those patients that are maybe close to discharge, those patients that are ready for discharge, and can actually take all that information, all those different inputs, and help us have the best staffing model for that patient, determine the hours per patient day for that patient, determine the staffing level on that unit. I see artificial intelligence really supporting that in the future.
Yeah, that sounds great.
Mhm.
So another question, in the case of camera use, how are privacy concerns integrated into AI? It's a good question.
John, you want to
Great.
take a stab at that?
Yeah, great question. I mean, what I would say is that, of course, patient health information, HIPAA, those are all things that are at the forefront of concern, right? Especially nowadays when it comes to people, valuing their privacy. And that could sometimes be a tricky thing to navigate, right? And what I would say when it comes to deploying these technologies, and really deploying any kind of technology that has an impact on people within your building, um, engage your legal team, your risk management teams, talk to the lawyers, talk to your chief legal counsel, and really get their input and talk to them about what your needs are and how you wish to deploy the technology, and listen to that legal team, because they have that expertise. They will guide you through what the privacy laws are specific to your state, because every state has their own specific types of laws when it comes to things. Of course, there's federal, right? But there are other nuanced things when it comes to your individual state. So that would be my big advice there: is don't do anything in a vacuum. Don't let the decisions be siloed. Make sure you get input from multitude of disciplines, including your legal and risk management teams.
John, you answered that perfectly. The other thing I was thinking about is having governance. If you're going to deploy any of these technologies, you need a governance committee and a structure, right? So you need to make
Sure.
sure, like, all the key players that you mentioned, John, should be part of that team, so that we're making sure that we're not contributing to any discrimination or any bias based on the information that the technology is allowing us to do. And there will be states, and I know there are some, that are banning the use of facial recognition for certain entities to use if it's law enforcement or other public entities. So I think we're going to see a lot more structure. I think we're going to see a lot more governance that's going to be required as we move forward with this technology.
Absolutely.
Fair, very fair. So I have a question. Who's reading the cameras in real time?
Well,
So
I mean, I think that that's going to be dependent a lot on your staffing model when it comes to security. But I mean, the purpose of the AI is that it will it will detect when there is an issue going on, so that while your camera operator at your security operations center or SOC, or if you don't have that amount of resources, if it's a smaller type of SOC, the AI is used to where a human doesn't necessarily have to be glued to 20 screens looking at something. It will preemptively, again, let you know, hey, there is someone walking in your garage right now with a rifle in his hand. That's a problem. Let's go get some resources out there. Hey, there is a woman that is in your surgical waiting room who just put her fists up in front of a doctor, and she has that fighting pose. So it will alert the security team in the background watching, and it will alert your staff. So that's really who's watching it. And Yeah, I think it really helps as a force multiplier. Again, it's very difficult as someone who's been inside of these socks. You're sitting in a sock for 15 hours, 14 hours at a time, looking at 20 different camera screens, and each screen has 5 views on it. It's very difficult to watch all of those cameras for any extended period of time and really be effective at it. So utilizing that AI to let the operator know is huge.
Yeah, it's
Absolutely.
amazing, and
Mhm.
can save lives and prevent disasters.
Absolutely.
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 And that's really the beauty of this, because we don't want to know when everything's good. We don't want to know when
Right.
every employee that's swiping through the door is authorized to swipe through the door. We don't care about that. We don't care when the cameras are watching a sunny parking lot and nothing going on. We want to see the exceptions. So the AI can
Right.
filter through those exceptions. And if you don't have a static officer or a static individual that's watching cameras or systems, it could push it right to the mobile device. So I could be anywhere and I can get an alert that somebody just entered an area that's restricted. And then I can get the recorded video and the live video right on my phone so I can respond appropriately. So when we talked about efficiencies earlier and the ability to reduce operating costs, I think that's a pretty good example right there where you might not need that security operations center in some facilities.
Right.
So true. So I actually know the answer to this, but I'm going to ask you anyway. Can AI be used to document notes in outpatient clinic visits?
Based on the research we did, yes.
Yeah.
Yeah.
Makes everybody's life
Yeah.
easier. I mean, how
Yeah.
much time are clinicians going to save
Oh, it's amazing. I mean, I think
with
it's going
notes?
to allow the clinicians to be providing patient care and not doing all those administrative tasks. And I think
Exactly.
that's really the benefit of it. And you're never going to replace a nurse. You're never going to replace a doctor. You're never going to
No.
replace somebody that has that empathy. AI doesn't have empathy. AI doesn't have compassion. AI can't give a therapeutic hold and touch somebody in a loving, compassionate way. You're not going to replace that, but it's going to allow caregivers, I believe, to provide better care because they don't have to do some of those other tasks.
Yeah, totally. Hopefully it'll happen sooner than later because we want to alleviate those tasks.
Mhm.
So how do you differentiate a subjective report from fact?
Well, I think that it kind of ties into the other question as well too. Um, and Paul just kind of touched on it too, right? The AI is never going to replace a nurse. It's never going to replace a doctor, and it is likely not going to replace a security officer
Right.
as well either, right? So the purpose of the AI is to basically tell you, hey, this is something you might want to look at, right? And then that human could come in and use their judgment and their training to determine whether or not that is a definitive fact of what's happening or if it is just a subjective. And also tying into the other question about how do you differentiate fists up versus a doctor performing an exam on a stroke patient is where the AI says, hey, we've identified something, we flagged something. And again, that human could come in and go, okay, that's a doc doing what he's supposed to be doing, or that's a patient that's, they're testing for mobility. So their arms are moving a certain kind of way, or they're doing something so that, the AI is not, it's not going to be that Terminator scenario where humans are completely replaced and it's just the computer that's doing all the thinking for us. There's always going to be that sort of a stopgap of a human that is flagged to the information, processes it, and goes, okay, we need to deploy some assets there, or that's a false flag.
That's good news. We still need people.
Absolutely.
Absolutely.
So this is just more of a comment. It is very controversial using AI to detect empathy. Apple just received a patent for phones to detect empathy. That's terrifying.
I would really like to know, how does it detect empathy? That's an interesting one. Um, huh.
Huh.
How would it detect empathy?
I don't know. Not
Maybe
that smart.
keywords.
Yeah,
I mean, who knows?
I would think
Yeah,
tone.
Oh,
Yeah, tone
reading
volume.
facial
Oh, okay.
facial
sure.
recognition.
Hmm.
If you're a
Yeah,
really good
perhaps.
actor, you could avoid that.
Yeah, that's true. That is true. You sound
Um,
like it. You sound like a security practitioner, Jamie.
Fabulous. Yeah, well, this has been great. Oh, we got a few more. who would act as, oh, no, sorry. So they're asking who would act as a patient. I meant, I was just kidding around. I don't think anyone would act as a patient. I meant if if a doctor were to not act empathetically like an actor. So as a retired nurse, this is a question, how would my practice have been different with AI by my side? Safety with my mentally ill clients probably would have been impacted, as witness to my clients threatening to sue me in the hospital.
Right.
Yeah, you guys can take that one.
Well, first of all, thank you for your service and dedication to the patients that you took care of. I think that, based on some of the examples we provided, I think AI could have, or could, may have, I should say, allowed you to be more efficient at your time. Maybe even had earlier diagnosis of a condition, and also help with appropriately identifying the medication. Because as you know, behavioral health, not everybody knows how to manage those psychotropic drugs, right? It's a specialty. AI, looking at all that information in the patient's medical record, could have helped identify the right medication earlier and get the patient on the appropriate plan of care earlier. So that would be my example of how it could have helped you.
I think I think she mentioned, the question went away there, but I think there was something mentioned about the patient suing me. I think the way that AI would have helped there is that if there was an allegation of improper care or inadequate care, the evidence and the documentation that the AI would provide would give you the backing for you to share that with your legal team or your counsel, so that you could present that to a judge or whoever, if it ever came to that, to help you and prove that, hey, we did do what we were supposed to do. Here is all the records of everything that we did. I think of a fall, right? If a patient were to fall down and break a rib, and then there's an allegation where, hey, they were mistreated, or it was something that a nurse did to injure the patient, and you would have video surveillance of, hey, look, here's the patient. It was an assisted fall.
Great point.
It didn't happen that way. Here's documentation of it. Here's video evidence of it. And that would have most certainly have helped you when it comes to litigation.
Yeah, hopefully, as one person said, it's a brave new, hopefully better world.
Right.
For all of our healthcare providers, who, by the way, we appreciate. You are heroes.
Absolutely.
And just always thank you for all you do for us. Something to think about if interested, in a way, there's an interest in a way to detect empathy in real time without self-reporting. I can save this information for you. I think this person might want to reach out to you.
Sure.
Capture that. And I think that is everything. Let me see if I have anybody else. All right. Well, I think we're almost at the end of our time. So I just want to thank both of you. As always, you always have the most interesting conversations and provide such amazing information that's so helpful to everybody. I will send everybody a follow-up email with a recording of the program and some information from us about how to stay connected and how to join us for a future program. So with that, happy Friday, everyone. Get out there and enjoy the day. Really appreciate your time and your effort. And, thanks again to our amazing speakers.
Thank you.
Thank you.
Right.
Appreciate
Have a
the
good week.
opportunity.